Diet recommendations for hypertension. A high-fat, high-sodium diet consists of processed food, desserts, carbonated and sweetened beverages, foods with high salt content. Studies suggest that it is associated with increased sympathetic system activity, stiffness of blood vessels, activation of angiotensin, a potent vasoconstrictor, in the heart and arteries, endothelial dysfunction, increased tissue angiotensin release from kidneys and adrenal glands, all factors which contributes to hypertension. On the other hand, a healthy diet consisting of low sodium and potassium-rich fresh fruits and vegetables causes weight loss, which contributes to decreased sympathetic tone, decreased stiffness of the large, vasodilation of small blood vessels and improved sodium excretion. High sodium triggers various processes in the body which all contribute to high blood pressure. It increases blood volume, cardiac output, and peripheral resistance. All these changes also cause increased renal excretion of sodium. But in primary hypertension, it is seen that renal excretion of sodium is impaired. Thus, there is excess sodium and water retention contributing to hypertension. Evidence tells us that reducing sodium intake alone is very effective to reduce BP in older people with hypertension and patients with resistant hypertension. According to guidelines, consumption of salt within a range of 1,200 mg to 2,400 per day is recommended. But studies also show that excess reduction in salt intake also increase risk of CVD. So, eating salt within limits is important. Not only patients with hypertension but all patients with pre-hypertension are also recommended to follow the DASH diet to prevent progression to hypertension. The DASH diet promotes eating fruits, vegetables, lean meat and low-fat dairy and limits salt intake. It also emphasizes on eating minimally processed and fresh foods. This is a typical serving guide for a DASH diet. When you go to a grocery store, buy healthy carbohydrate sources like green leafy vegetables, whole grains, low glycemic index fruits, legumes and beans. Healthy fat sources such as olive oil, avocados, nuts, hemp seeds, flax seeds, fish rich in omega-3 fatty acid. Avoid margarine, vegetable shortenings, partially hydrogenated vegetable oils. Look for healthy protein sources such as legumes, soy products, nuts, and seeds, lean meats, low-fat dairy, eggs, and fish. Processed meats are not recommended. Also take some foods rich in potassium, calcium and magnesium. Finally, for having a controlled blood pressure, follow the DASH diet. Decrease sodium intake, maintain a body mass index of less than 25 and limit alcohol consumption.